Good afternoon, everyone. I'm Eileen Doherty, and I'm the Executive Director of the Colorado Gerontological Society. And today we're going to talk a little bit about the Medicare Savings Program and extra help. As I hope that everyone is soon coming to understand, Medicare has parts A, B, C, and D, and insurance companies, Medicare Advantage, prescription drugs, and Medicare supplements have plans. And what we're going to be talking about today primarily is parts C and D of Medicare. In case you haven't seen anything in the media, the Medicare premiums for 2026 have been announced. We thought they were going to be $206 per month. However, when the numbers came out last weekend, it's a little less than that, $202.90. So basically, it'll save us all a few dollars, not a lot, but a few dollars, and maybe a cup of coffee. So everybody has to pay the Part B premium, and unless you have some programs such as the Medicare Savings Program paying your Part B premium. So now we're going to talk a little bit about the Medicare Savings Program and the benefits. So there are three parts to the Medicare Savings Program. One is QMB, two is SLIMB, and three is the QI1. So they're frequently referred to as QMB, SLIMB, and QI1. QMB basically is for people who are very low income, pays for the Part A and B deductibles, pays for the Part A deductible, premium, and or the B premium, and then it pays co-pays, co-insurance, and it can also pay for any late payment penalties that you might have for either Part A or for Part B. SLIMB are the special low income benefit, and the QI1. Basically, the only difference of the two is the income requirements, but both of those programs then only pay the Part B premium, which is the $202 for 2026. So who qualifies for QMB? We still have the 2025 numbers, and the reason being for that is because these numbers will not go up until the end of February or March when the federal poverty level information is released. So at this point, we have for QMB, a single person, $13.25 per month, and a couple is $17.83 per month. The resources for all three of these programs are static. So it's always less than $12,660 for a single and less than $20,470 for a couple. Goes up just a little bit for the SLIMB to $15.85 per month for a single and $21.35 for a couple. And for QI1 goes up to $17.81 per month for a single and $2,400 a month for a couple. So the next thing we need to pay attention to is, given those relatively low income guidelines, what actually counts as income. So basically everything that looks like a cash or a check is going to count. So Social Security or veterans benefits, pensions, any other kind of pension or railroad benefit, if you have a rental, any wages or self-employment, alimony, workman's comp, income from annuities, stocks, anything like that, where you get an actual physical check, or if you have like a annuity and you get a $20 dividend check, or something, then that would count as well. What doesn't count, which is also really important, is food stamps or SNAP, LEAP, housing assistance. If you get help from others who pay household expenses, and what they mean there is that if you are living with someone and say you share the rent, so say the rent is $2,000, you pay $1,000, your friend pays the other $1,000, that help that friend pays is not counted unless that friend sends you a check or gives you cash for their portion of the rent. So oftentimes, if you are sharing expenses, we totally suggest that anybody that you share with, that it be paid directly to the vendor, not to you. Anything you might get through earned income tax credits, disaster payments, victim assistance, other things that are exempt are things like scholarships, education grants, any kind of medical treatments, or any kind of drugs. So again, those are all, they do not count. Similar, or they do count. Things that are exempt in the way of resources is your home. You get to keep one car. You can have an irrevocable burial plot and plan. You can have an additional $1,500 for burial expenses, and that gets counted in that $12,000 of resources. Any kind of furniture and household items. And this one here often causes people difficulty. Life insurance is exempt if it is a term policy. And what a term policy means is that it has no cash value. You can't borrow against it. The only way that it can be claimed or has value is if you die. Now, non-exempt resources that you have to be aware of is, again, this is money. So if you have additional money in a checking or savings account, say you have $5,000 in a savings account that you're saving for an emergency, that would count. If you had any stocks or bonds, what catches some people sometimes is what I call, you have a second car, kind of an old junker, that is in your name. If you have two cars and the total amount of your money in the bank or checking account, as well as your second car, goes over those resource limits, then you would probably be wise to consider disposing of that second car. If you have any money in IRAs, annuities, or whatever, and then, as I said, the whole life insurance does count. And what counts is not the value of the policy when you die, but the value of the policy if you cashed it in whatever day you are applying for benefits. So if you had a $50,000 whole life insurance policy, and if you cashed it in today and it was worth $25,000, that would put you over the amount for non-exempt resources. So how do you apply for the Medicare Savings Program? You can apply either with paper or online. You can go to the County Department of Human Services, and when I send you the slides, if you click on that link, it will take you to the County Departments of Human Services, and you can get a paper copy. You can also apply in English or in Spanish at Colorado Peak, and that link will take you there. It used to be that we used to really recommend doing paper copies. The department is so overwhelmed with paper these days that we highly recommend that you apply online, because that gives us a real-time date stamp of when you applied. It also gives us a confirmation number and allows us to track it better should there be any problems or confusions. Now, there's a really, really big change coming to all Medicaid, including the Medicare Savings Program, come the 1st of January of 2027. So based on HR 1, which was the bill that President Trump signed on July the 4th, everybody who is eligible for Medicaid, and I'll just add in here SNAP, is going to have to redetermine every 6 months. The paperwork burden is going to be extremely big and extremely difficult for both the counties as well as for older adults and anyone who needs to apply for those benefits. Under Medicaid, starting January 1, if for some reason you happen to be getting Medicaid between the ages of 18 and 64, you may also have to meet work requirements. And that there should be more guidance and information about that over the next year. One of the things that often prohibits people from signing up for the Medicaid or the Medicare Savings Program is a program called estate recovery. And estate recovery is a program whereby the state of Colorado, if you use Medicaid, can in fact put a lien on your home. However, if you enroll in the Medicare Savings Program, they cannot put a lien on your house. And so many counties mistakenly will ask you to sign that form. Never, never, never sign that form, because that gives them permission to actually put a lien on your house if you are enrolled in the Medicare Savings Program. Now, if at some point in time you leave the Medicare Savings Program and you end up applying for full Medicaid, say you have home and community-based services coming into your home, then they would be able to put a lien on your house, and you would then be subject to the estate recovery. If a county insists on it and says, we're not going to give you benefits unless you sign, please call our office and we will call the state and ask them to do retraining with their staff. So the next thing we're going to talk about a little bit is a companion program called Extra Help. Medicare Savings helps you with Part B. Extra Help helps you pay for Part D or prescription drugs. So what Extra Help will pay for or does is they will pay the Part D premiums. They will give you lower co-pays. They'll pay the annual deductible, and they cover the drugs that are on the formulary. Now, these benefits only apply if in full, if you apply for a Part D plan, a prescription drug plan that offers Extra Help. If you apply for a plan that offers is not one of the listed ones, then Extra Help can still pay, but you would have to pay the difference of the premium. You might have to pay some on the deductible as well as the co-pays. So who qualifies for Extra Help? Again, we are using 2025 numbers because this program also uses the poverty levels, which come out in end of February or March. As you can see here, the income requirements and the resource requirements are higher. The resources, again, are consistent. So you can make a little bit more income as well as save a little bit more to qualify for Extra Help. What counts as income? This is the identical list to what we saw a few minutes ago under the Medicare Savings Program. Similarly, what does not count is the exact identical list again. And similarly with resources, what's exempt and what counts. So from that perspective, the two programs run parallel, and you have to meet those same requirements. What do you pay with Extra Help in 2026? Again, if you enroll in one of the participating Part D plans, then you would pay $0 for premiums and deductibles. If your income is less than 100% of poverty, you would pay $1.60 for generics and $4.90 for brand. If your income is a little higher, you would pay $5.10 for generics and $12.65 for brand. And the other thing is that if for some reason you have a late payment penalty, you would not have to pay that. That would be absorbed. These are the 3 plans that are offering the 0 premium Part D plans. Now, it's also important that you know exactly which one of these that they are covering. So when you talk to the company or when you look at it, make sure that you get the right plan number, because these companies offer other prescription drug plans, and not all of the plans on their offerings are eligible for the 0 premium. Who gets Extra Help automatically? If you are full Medicaid. These are people who are getting supplemental security income along with Social Security and Medicare. These would be people in nursing homes. This would be people on home and community-based services. Other people who get Extra Help are the Medicare Savings Program, which are the folks that we just talked about. And as I said, supplemental security income. How do you apply for Extra Help? So unlike the Medicare Savings Program, which is administered by the County Department of Human Services, Social Security administers Extra Help. And so you can apply online. That is, again, the preferred way, because now you get a live date stamp when the application was submitted. So if we have any questions, we can always refer back to that date's timestamp as well as the confirmation number. You can call Social Security and they can take your application over the phone. They may schedule you an appointment for a local office. They may schedule you for an appointment at a future time, or they may just take the application right when you call. The Senior Health Insurance Counseling Program, or the SHIP, or other community-based organizations might also be able to help you. And if you want to call the SHIP, that number is 1-888-696-7213. What kind of information do you need to apply for Extra Help? You'll need your bank statements, if you have any tax returns, any IRAs or other investments, pensions, private pensions. They can get access to your Social Security. So you don't need to really worry about Social Security. But if you have a private pension, say from the state of Colorado or from Lockheed Martin or whoever, veterans benefits or veterans pensions, those will need to be, you'll need access to those. And we don't see a lot of these anymore, but Railroad Retirement Board benefits as well. So what happens once you are approved for Extra Help? If you don't have a drug plan, Social Security Administration is going to automatically just enroll you in one of those participating Part D plans in your state. You should, if they do that, you should basically do a review of the prescription drugs that you have and see if all of those are on their formulary. You'll also want to check to see if that the pharmacy that you use is in the network. Again, you can probably go to have access to multiple pharmacies in the Metro Denver area, but that's not as easy as it is if you in the Denver area, if you are in a rural area. If you already have a drug plan and you just found out about this program and you go ahead and register or enroll in it, then Social Security is going to send you a letter with the start date for your coverage. If the plan that you have does not accept extra help, then you basically can get a special election period and you can enroll in one of the plans that participates, or you can stay with your current plan and pay the difference in premiums, deductibles, and possibly copays. One of the things, if you once get approved for extra help, we have a thing called continuous coverage or redetermination. So if you get benefits in the middle of the year, if there's no change in your income, you're satisfied with everything that you have, then your extra help will continue on into the next year. And one of the things that Medicare has done is that they have color-coded some of their letters. So if you get a purple letter from Medicare, it should say that your coverage is being continued. This usually comes in October, November, for coverage to start the following January 1. The other thing that happens is that if you apply first for extra help, the County Department of Human Services is going to get notified that you might be eligible for the Medicare Savings Program. You then will get a letter from the county and they'll ask you to submit some documentation to see if you are then eligible as well for help with your Part B benefits. If you apply first for the Medicare Savings Program, you will automatically be enrolled in extra help and you don't have to go through Social Security. The other thing we want to talk about just a little bit here this morning is the Medicare Advantage Special Needs Plans that are available to individuals who are what we call dual eligibles. So a special needs plan is basically they are offered by Medicare Advantage plans. They try to provide additional benefits for severe and chronic disease. They offer care coordination, and a lot of their benefits are tailored much more to meet individuals who might be more frail, who need more service, who need more care. There's also a new program that is available in the Denver area called value-based care, where you can sign up for a primary care physician that participates with some of the Medicare Advantage plans as well. So sometimes people say, what is a Medicare special needs plan and a dual eligible? Basically, you meet that definition of a dual eligible if you're receiving Medicare and you get Medicaid. You don't necessarily need to enroll in a special needs plan, but that is the definition of a dual eligible. And we hear a lot about duals. People talk about them in cost situations, about people who are duals using a lot of care. We're always looking for ways to reduce costs, to do more interventions. So that's who that is. Now, for a special needs plan, or they're often called SNPs, you have to have Medicare Part A and B, and you have to live in the plan's service area. Now, in Medicare's usual fashion, there are three types of SNPs or special needs plans. There are D-SNPs, C-SNPs, and I-SNPs. So to be eligible for a D-SNP, you have to have full Medicaid, the QMB program, QMB Plus, the SLIMB only program, SLIMB Plus, or the QI qualified individual. So if you have any one of these programs, you would be eligible for a D-SNP. A C-SNP is basically stands for chronic condition. So you have to have one or more of the following severe or disabling chronic conditions to be eligible for a C-SNP. And then there is the I-SNP. And an I-SNP says that you have to live in one of these kinds of facilities. The majority of them that are available in Colorado are people who live in nursing homes and people who live sometimes in assisted living, which in this definition is like an intermediate care facility. It's not that you couldn't be eligible for I-SNPs in these other types of facilities, but for the most part, people are not there for a long enough period of time. But if you go to one of them, your coverage would continue and follow you. So how do the SNPs work? Well, first off, as I said, they're offered by the Medicare Advantage plans, either through their HMO or their PPO. And so because they're a Medicare Advantage, they have to follow all of those MA rules. Those rules about giving you notice, about they can't just call you blindly, that they have to have an appointment, they have to record the call, all of that applies. You can always, if you sign up for one of these special needs plans, you can always go back to original Medicare and Medicaid if you want to change. Now you can change once a quarter in Q1, Q2, or Q3. They don't let you change in the fourth quarter of the year. So what do the SNPs offer? Mostly, as I was putting this slide together, I felt like there was a lot of variation. And it really does depend on the Medicare Advantage plan and what they have filed with Medicare. So a lot of them have no premium, but there may be a premium. Often there is no deductible, but there might be. They are required to offer prescription drug coverage. Now, what the formulary looks like varies from company to company, but they do have to have prescription drug coverage. Some of them may have a limited pharmacy network, such as Kaiser. So if you were to sign up for Kaiser's special needs plan, you would have to use a Kaiser doctor if you're not currently in the Kaiser system. So you might have to change. Sometimes, most of the time, they do require that you have a primary care physician. You may or may not need a referral to a specialist. Oftentimes they offer this similar, if not the same, additional benefits that an MA plan offers, such as vision, hearing, and dental. They may offer these cashback cards that say if you have a card and you might get $100 back that you could use for over-the-counter service or products such as Depends or Tylenol or whatever, or they may give you like a cash offer kind of thing of some kind. Some may offer premium rebates. What that means is that there would be a reduction if you did have to pay a Part B premium. So you might get a 50% off of the $200 down to $100 if you had to pay it. And one of their really big specialty areas is care coordination. The goal with the D-SNPs is really to help you use all available medical care and health services to keep you as healthy as possible. So you can enroll in a SNP, and any one of these companies are offering SNPs. Now, Longevity Health Plan and Perennial are only offering the I-SNP. I'm not even sure if any of the other companies are offering a C-SNP, For the most part, what they're offering is the D-SNP, which is for the dual eligibles. You would basically talk to a broker that is licensed to sell for one of more of the companies for specific enrollment information, or you can go to Medicare's website and you can go to the plan finder, and there you should be able to find which companies or which plans each company is offering that is identified as a special needs plan and enroll through the website. So that kind of brings our discussion to an end here about specifically what we're doing with extra help and the Medicare Savings Program, and a little bit about the coordination of those benefits with Medicare Savings Program or with special needs plans. So just a little bit about CGS services, or what we are offering and making available. These two legislators, Representative Karen McCormick and Kyle Brown, are going to be introducing a bill in the legislature. If for some reason or other you were in original Medicare and you had a Medicare supplement and you decided that you were going to enroll in a Medicare Advantage plan, which you can do every year, but say at some point down the road, you decide that you want to leave your Medicare Advantage plan and you have pre-existing conditions. So what this bill would do, if it passes, is basically it would say that you can go back to a Medicare supplement from your Medicare Advantage plan with pre-existing conditions without underwriting. Apparently, there's been quite a bit of request for that service. And so these two legislators are teaming up to work with the legislature to see about making some changes. Some other things that we are doing are some Medicare counseling and services. We have one more virtual Medicare Monday session available, which will be December 1st. Similarly, we have one more new to Medicare virtual session left, and that will also be on December 1st. There might be one more Wednesday lunch and learn. I actually did not check the schedule. We have struggled, but we're still working on the self-enrollment guides to basically kind of help you through with some short videos. Some of those may have been posted already, I'm not sure. We have created a licensed Medicare broker provider directory, and we're going to be sending out information about those providers soon. So if you're looking for a broker, you would be able to select from one of those if that meets with your needs. And then if all else fails and you still need assistance, you're welcome to call our staff for support. Just a quick list of some of the services that we provide here at the Society. And our dental grant program at this point is closed. We took a $40,000 cut from the state about 2 weeks ago as part of their budget balancing. So we have committed and allocated all of the funds that we have. We have a short waiting list, and any excess funds that we might realize over the next month or two, we'll have to use, or we'll plan to use toward our current wait list. The rest of these services are programs that we have had as ongoing. We are gearing up for our Holiday Basket project. Holiday baskets will be delivered on December the 13th. The 13th. If you are low income, or if you are going to be alone over the holidays and you would like to apply, you can go online at senioranswers.org there is a banner there. Click on that. Apply now or more help or whatever, little box. And then if you scroll toward the bottom, you can click on a button and you can fill out the online form, or you can call the office and have a copy mailed or faxed to you. Applications are due November 30th. This is just another list of some of the different services that we provide. On Saturday and Sunday of this coming weekend, CGS hosts a radio program on Legends Radio, and we're going to be talking a little bit about an overview of some of the benefits, just to make sure that people are kind of tuned in and know where to apply for those. And so you can listen on Sunday morning or Saturday morning on Legends Radio at 93.5 or FM or 810 AM if you are interested in learning more about that. If you don't want to get up that early and listen to the radio, we do post those on our YouTube channel as well. And with that, I will close our remarks.